As a nurse prescriber working in adult ADHD services, one of the most time-consuming and high-risk parts of my job was the pre-medication consultation. As you know, before initiating any ADHD medication, I needed to cross-reference contraindication and check drug interactions, review baseline observations, and document everything. I was doing this manually, juggling the BNF, shared care protocols, SPC, and my own clinical knowledge at the same time. It was slow, inconsistent, and carried real medical legal risks if anything was missed. So I built this software. It's an ADHD pre-medication initiation screening tool. It's a structured clinical decision support tool that guides prescribers through the full pre-initiation screening for all adults ADHD medication. It will flag up any contraindication in real time, check drug interactions by name, and it will generate a clinical summary ready to paste in your notes. It's built around NICE guidelines, shared care protocols, the same guidelines every UK prescriber is working to. It's built in as well with an AI assistant, which will, if you ever need to quickly check an answer mid-consult, AI will help you with that. Let me show you how it works. To begin, you click New Screening, enter the patient's name, date of birth, and NHS number. All are completely optional. You can select from 4 medications, including lisdexamfetamine, methylphenidate, atomoxetine, and dexamfetamine. For this demo, we'll use lisdexamfetamine. The tool runs through a structured safety questionnaire before any medication can be started. Simply answer yes or no for each question based on the patient's history. If a patient answers yes to any contraindication such as suicidal ideation, or breastfeeding, or known allergy, a tool immediately flags up advices against starting the medication. So it will support you with your known clinical knowledge. So if you're unsure about anything, the system will flag it up. If a patient answer no, you can just go through each stem. If you answer yes, the system again will flag it up. Where a test or investigation is required before prescribing, such as an ECG, the tool will prompt you with a clear recommendation, like this. ECG triggers. If you're unsure about anything during the consultation, I don't know, like a clinical question, a drug interaction, there's a built-in AI assistant. You can just type your question. You can get an immediate evidence-based answer, so you don't need to leave the consultation to search elsewhere. Like this MAOI drugs. Or you can see it will list all drug and any antihypertensive medication. You can cross-reference in the patient's notes. This section is particularly important because not all prescribers will be familiar with every drug interactions relevant to ADHD medication. So if there's any QT prolonging medications, um, the software will list any of those medications here and will flag it up high risk. So there's a dedicated section covering all QT prolonging drugs. If a patient is taking, I don't know, citalopram or any other QT prolonging medication, the tool flags this and clearly flashes an advice on next steps before initiating. The last screen will be entering the patient's vitals, like like the patient's blood pressure, heart rate. The tool will automatically flag any abnormality values, for example, a heart rate above 100, or a blood pressure greater than 140. This ensures baseline observations are always reviewed and documented before prescribing. Once the questionnaire is completed, the tool generates a summary of any issues identified alongside dosing guidance if prescribing can be safely started for the selected medication. The AI then produces a full clinical report ready to copy and paste directly into your clinical systems. You can just copy and paste. You can also export it as a Word document or a PDF, or you can print the consultation if needed. If you're an independent nurse prescriber or running an ADHD service, this tool was built for you. There's a 14-day free trial, no credit card required. Thank you for watching.